Hi, everyone. Today I'm going to be talking about how interictal spike networks can be used to predict surgical outcome in patients with focal drug-resistant epilepsy. Now, epilepsy is generally characterized by seizures or interictal epileptic discharges. On depth electrode EEG recordings, these discharges tend to look something like this over here on the right-hand side. And previous literature showed that epileptic activity, or IEDs, can in fact propagate from one region of the brain to another region. And worldwide, epilepsy has a prevalence of 1%, where a third of these patients are resistant to pharmaceutical therapies. And these are the patients known to have drug-resistant epilepsy. Now, one of the most common treatment options for these patients is epilepsy surgery, which involves the resection of abnormal epileptic tissue known as the epileptogenic zone. Unfortunately, we only see seizure freedom in 60% of well-selected cases. And these imperfect success rates can largely be attributed to difficulty in localizing the EZ, which again is the area of the brain responsible for generating epileptic activity. Now, we set out to build epileptic networks using interictal epileptic discharges, or IEDs, to see whether these networks could predict surgical outcome and whether they were clinically useful for surgical planning. My first hypothesis was that these networks can in fact differentiate between sources of IEDs and areas of propagation. And second, that inclusion in the resection of IED generators will be associated with seizure freedom more often than inclusion in the resection of regions to which IEDs propagate. Now, the bulk of the methodology has to do with constructing the IED network. And here we use 40 drug-resistant epilepsy patients. We took 30-minute depth electrode EEG recordings from each patient, and then we ran an automated spike detection algorithm. After we knew where all the spikes were, turn by turn, for each spike across every channel, we constructed a 120 millisecond window, time window, highlighted in blue here. And then we simply just went down the page and counted the number of times that there was also a spike detected in some other channel within that same time window. And then across detections, we looked to see if that these detections or the time delay between these detections, between any two channels, were consistent or not. And we assumed a propagation relationship where whenever there was a statistically significant and consistent delay between IEDs at two channels. And that led us to something like this, where here's a network that includes 5 depth electrode EEG channels. And as we can see, only 3 of the channels, A, B, and E, are actually involved in the network itself, which means that they showed statistically significant propagation between themselves. So here we have channel A, which serves as a source node. And this is the generator of epileptic activity that's responsible for the propagation of IEDs to either intermediate nodes or terminal nodes. And all IEDs detected at these source nodes are known as source spikes. So when we compared how often source spikes were seen in the area of resection that was removed during the surgery between good outcome patients and poor outcome patients, we found that the most active source nodes for any given patient are more often included in the resection for good outcome patients in green versus patients with poor outcome in blue. Now, to illustrate this with pictures, here in figure A, we have a diagram of a good outcome patient. And what we can see is that both of this patient's source nodes or generators are included in the area of resection highlighted in red. And consequently, this patient was seizure-free after surgery. Now, on the other hand, here's an example of a poor outcome patient. And as you can clearly see, that none of the source nodes or generators are included in the area of resection. And as you might expect, this patient continued to have seizures after epilepsy surgery. Now, from all this, what we can take away is that interictal spike propagation can delineate the generators of epilepsy, and that resection of the most active source node has a high chance of resulting in seizure freedom, and that these measures may assist clinicians in the surgical planning of epilepsy surgery. Thank you for listening.